Hello, I'm Dr. Roman, and these are the most asked questions about dental cleanings. What are four types of dental cleanings? Okay, so there are four types of dental cleanings as implied by the question. The first cleaning is prophylaxis. This is when you're healthy, your gums are healthy, you floss every day. All we need to do is just remove a little bit of plaque, remove a little bit of calculus, and everything is good. So that usually happens once every 6 months. And as long as you keep up with that, there should be no problems. Continue your brushing, continue your flossing. You will never have gum or bone problems in your life. Second type of cleaning is scaling in presence of inflammation. So it sounds really scary. However, this is not very far removed from a regular cleaning. So a regular dental prophylaxis is when we remove some light calculus and some light plaque. A scaling in presence of inflammation implies that we have to do a little bit more work. However, there is no loss of bone around the teeth. Yes, we have more plaque to clean. Yes, we have more calculus or tartar, as they call it, to clean up, but we have not lost any bone surrounding the teeth. So the bone is good and healthy. However, the gum is angry. So what we do is we clean out the plaque and calculus that has been sitting there for a few years, and that way the gum returns to health and there's no bone loss. So this is great news. If you need the scaling, get it, your gums will be happy. Third type of cleaning is scaling and root planing. So because now we have to work with the root of the tooth, that means the bone level has been lost and the roots are exposed. When the roots are exposed, we absolutely have to clean up the root in order for the gum to calm down and start getting healthy. If that doesn't happen, the bone will resorb until the tooth falls out of the bony socket that it's housed in. So in order to prevent that, we do a scaling and root planing, which is in layman's term is a deep cleaning. So when we say deep cleaning, that's exactly what we do. We go deep underneath the gum, around the tooth root, so that's clean and is no longer irritating the gum by presence of calculus. And we usually do this under local anesthesia, so our patients are not sensitive when we do this. After we do this, we move to the fourth type of cleaning. The fourth type of cleaning is periodontal maintenance. The periodontal maintenance is necessary for when we have done our deep cleaning and all we need to do is upkeep. It's just like you doing a mega clean on your house. You move the couches, you move the fridge, you move the stove, you mop everywhere, make sure there's no dust anywhere, you put everything back, and then you don't have to do that again for many years because everywhere is clean. You just need to dust a little bit, to mop the floors, just to upkeep the situation. Same thing here. Once we have done the deep cleaning, we just upkeep the situation so you don't have to face the deep cleaning again. We just do a periodontal maintenance once every 3 to 4 months. So that's 3 to 4 times a year, just to upkeep the healthy situation now. What happens if the teeth are not cleaned regularly? As much as we want to hope that everybody on earth is a perfect brusher and a perfect flosser, that doesn't happen, unfortunately. Everybody misses a little bit of plaque. Everybody misses a little bit of calculus somewhere. So just because there is no perfect oral hygiene person, we have to go back in every 6 months and get those areas cleaned up professionally. When that doesn't happen, those areas start to accumulate a lot more tartar, which is calculus, and plaque. So those things house bacteria, and as those things get bigger, they irritate the gum, and as gums get more irritated, they start to dissolve the bone level. So if my bone level was here, then after my gums are inflamed for a certain period of time, the bone level will start to decrease, and that means there's less bone around the tooth root, and so there's less support for the tooth. If that keeps on happening on a gradual basis, after a decade or two of this process, the teeth just fall out. They become very wobbly. They become painful to use. You can't chew anything. There's bad breath, bad odor, and aesthetically, they don't look great. And then at the end of that road, we have to remove all the teeth and get dentures, unfortunately. So moral of the story, get your cleanings done on time and regularly, just so we don't lose your teeth. Do regular dental cleanings improve your dental health? The answer is, of course, and absolutely. They improve your dental health because you have less plaque, you have less calculus, so less inflammation, less irritation, less bacteria. Of course, that's going to improve your general dental health. How often should I get my teeth cleaned? If you're healthy, ideally twice a year. If you're not healthy and you've had some bone loss, 3 to 4 times a year is the right answer. How does a dentist do a deep cleaning? So we do a deep cleaning in the following way. First, we get you numb. We don't want you to feel anything of the deep cleaning because we have to go deep into the root of the tooth, into the gum, to get that area cleaned up. And if you're not numb, that's kind of painful. So we get you numb. We use ultrasonic instruments and then manual instruments to make the tooth really smooth and keep the gum happy. So what keeps the gum unhappy is the tartar and calculus, which is the same thing, keeps the gum unhappy around the tooth root. Once that is removed from the root, the gum will become healthy, pink, a lot more sturdy, and will stop bleeding when you're brushing or flossing. Once we're done with the deep cleaning, we will take an x-ray to make sure we have removed everything from the tooth root and the tooth crown itself just to check our work. We want to make sure that we did the best job for you. This is why we do that. Do dental cleanings remove tartar? Yes, they do. That's kind of the idea. Do dental cleanings make teeth whiter? A dental cleaning usually does not change the intrinsic color of the tooth. It's just like if your kitchen counter is white and you wipe the kitchen counter, it still remains white. However, if you have pigmented drinks such as coffee, wine, tea, and sometimes cigarette smoke, you can get pigmentation onto the tooth. Imagine if you have a white counter, you spill some coffee, and you leave it there for a day. Once you go clean this up, you will see that you have a brown splotch on your countertop. Then what you have to do is get some sort of material to scrub this area with, and then it turns back to white. Same with the tooth. We have some sort of a staining, we scrub it really well, and then that returns the tooth back to its original color. However, a dental cleaning does not usually change the intrinsic color of the tooth. So if your perfectly healthy tooth was slightly yellow, it's not going to make it pearly white. We have either take-home bleach services or in-house whitening services for that. That will fundamentally change your tooth color. Does a hygienist's teeth cleaning usually hurt? Dental cleanings don't usually hurt. However, they can induce a little bit of tooth sensitivity. Why? Sometimes we have areas where our gums have receded and have exposed the root of the tooth, and those areas are sensitive to our ultrasonic instruments. If that's the case, you can either ask your hygienist or your dentist to use a manual instrument on that area, or you can ask the dentist or hygienist to get the area numbed, and there's no problem. How can I schedule a teeth cleaning appointment? If you'd like to be seen here at Pacific Park Family Dental by my partner, Dr. Joe, or myself, please give us a text or call 360-726-6107. Thank you.